Bismillahirrahmanirrahim. Today we will discuss the clinical condition or disturbance in the body water and electrolyte balance. Now, first of all, some terminologies like tonicity, um, hypertonic and hypotonic conditions. You have discussed earlier in about these condition in the first year. Tonicity, when there is abnormal amount of fluid and electrolyte imbalance, we can say. Hypertonic situation, when there is dehydration of the cell due to the increase osmolality. And hypertonic, when there is decrease osmolality. And we will discuss in the next slide about these conditions and their effect on the body. Now there will be expansion and contraction of the extracellular fluid. The expansion include isotonic condition, hypotonic condition, and hypertonic condition, and the contraction include isotonic, hypertonic, and hypertonic. We will discuss in detail about these expansion and contraction in the next slides. First, here you see the expansion of the extracellular fluid and the contraction of the intracellular fluid. Their biochemical feature they will be discussed again in detail. In isotonic condition, there is retention of sodium and water. In hypotonic condition, there is amount of excess water. In hypertonic condition, there is relatively high amount of sodium, and so on. Now, first clinical condition which is due to the disturbance of the body water is the dehydration. And dehydration means when body loses too much amount of fluid. Now, there are many causes of dehydration. Here you can see the different amount or different causes that can be the main reason of dehydration, in which there is prolonged exercise activity, or there is prolonged exposure to the dry air. And in deserted condition, there is excessive blood loss. In diarrheal condition, hyperthermia, that means excess of temperature. In shock condition of the body, and in vomiting. Then there is malnutrition, that is less amount of nutrient taken in the body, in which there might be the electrolyte imbalance, for example hypernatremia, that is excess amount of sodium, or hyponatremia, that is low amount of sodium. Excessive consumption of alcohol in fasting condition, when there is rapid weight loss, or when patient refuse to eat or take water or fluid inside the body. Then there will be the infectious causes that can dehydrate the body, like cholera, gastroenteritis, and so on. And in other causes of the metabolic pathways, there is excessive hyperglycemia in diabetes patient, and glycosuria. Symptoms of dehydration. Dehydration symptoms include thirst and discomfort, loss of appetite, dry skin, low stamina, rapid heart rate, elevated body temperature, headache, and decreased blood pressure, sudden episode of visual snow, and dizziness. And in these conditions, if there is untreated dehydration, it can cause delirium, unconsciousness, or ultimately body can go to the coma conditions. Treatment of dehydration mainly is intake plenty of water, or IV isotonic solution, or intake of electrolytes, either oral or intravenous, and monitoring of the water and electrolyte status of the body. Next clinical condition is overhydration. It also called as water intoxication. Uh, it is also known as hyperhydration or water poisoning when there is excess amount of water, highly excess amount of the water in the body. And if there is high amount of water in the body, then salt and other electrolytes which are present in the body, they will become too diluted, and they can cause the upset of the osmotic pressure, which affects the passive transport function of the body. And uh, there is drinking of excess water in the absence of sodium. Hyponatremia will occur. Hyponatremia mean a low amount of sodium, or condition in which sodium become dangerously low. And due to this, there will be the shift of water from the blood to the brain cells, and it sees the functions of the brain cells. Causes of overhydration or water intoxication includes congestive heart failure, liver disease, mainly kidney problems, and if there is inappropriate production or less production of production of antidiuretic hormone, and there is non-steroidal anti-inflammatory drugs, and if there is condition of uncontrolled diabetes. Symptoms of water intoxication includes nausea and vomiting, headache, confusion or disorientation, and if it is left untreated, then there will be more severe symptoms like muscle weakness or cramps, seizure, unconsciousness, or coma conditions. Water intoxication treatment is the cutting back of water intake, or taking the diuretic so that there is increased production of urine, and stopping any medication that can causing the problem of water intoxication, or treating the underlying condition that can causing overhydration. And in most cases or in severe cases, there is replacement of sodium. Now, there are pathological variation that I have discussed in the earlier slide. Now we are discussing it in detail. Three expansions and three contraction: hypotonic, isotonic, and hypertonic. Now, first of all is hypotonic expansion. There is accumulation of water without equal amount of salt. This is hypotonic condition, and in this condition there is high volume of intracellular fluid, high volume of extracellular fluid, and low amount of plasma sodium, and low amount of plasma protein. There will be low excretion of sodium and high excretion of the water, so there will be low osmotic pressure, and there is inhibition of anti-diuretic hormone, and this is occurring in case of water intoxication. The cell of brain also share this process, and it leads to the convulsion and even death of the body. Then isotonic expansion, when there is equal amount of salt and water intake, uh, they both are in equilibrium or in equivalent amount, sorry, and in these conditions there is no effect on intracellular fluid, but there is high volume of extracellular fluid, no effect on plasma sodium, but there is low amount of hematocrit and plasma protein, and in urinary findings there is increased excretion of sodium as well as increased excretion of water. Then hypertonic expansion, when there is accumulation or retention of sodium, and in these conditions there is low volume of intracellular fluid, high volume of extracellular fluid, there is high amount of plasma sodium, and low amount of hematocrit and plasma protein, and in urinary excretion there is high excretion of sodium and high excretion of water. The effect of this condition is that there is dehydration, and if this state is continued, then the cell of the central nervous system get become damaged. Then hypotonic contraction. In this contraction, there is loss of excess amount of salt from the body, uh, and in these conditions, the changes in the body, high volume of intracellular fluid, low volume of extracellular fluid, low plasma sodium, and high plasma protein, and in urine there is high excretion of sodium and high excretion of water. And in this condition, uh, there may be or adrenal cortical insufficiency. Then isotonic contraction. In isotonic contractions, uh, there is no uh, effect on volume intracellular fluid, but high volume of extracellular fluid, no effect of plasma sodium, and there is high amount of plasma protein, and in urine excretion there is low excretion of both sodium and water. And this condition is mainly arised in untreated diarrhea. And then hypertonic contraction. These contraction arises when there is uh, excessive loss of water without loss of sodium, and this is mainly in patient with diabetes insipidus. And the changes which are present in the body, that is low volume of intracellular fluid, low volume of extracellular fluid, there is high plasma sodium, high plasma protein, and in urine excretion there is high excretion of sodium and low excretion of water. And there is again the clinical condition, the osmotic pressure of both the intracellular and extracellular compartment can increase. Thank you so much. If you have any question, then please let me know um, in the comment section.